The collaborative effort from the Nebraska Attorney General's Office, the United States Attorney General's Office, the FBI, the DEA, Nebraska State Patrol, and local law enforcement across the entire state, emphasizing the priority that we all have for this incredible effort to combat the methamphetamine problem within our state and across the United States for that matter. As a representative of local law enforcement, I can't tell you how important this relationship is, not only for the enforcement effort that these folks will talk about today, but also for the education and prevention steps that will be taken throughout the entire state. Myself and the Kearney Police Department are 100% committed to this effort. We've proven time and time again that we work together towards these issues, whether it's with narcotics or whether it's with forensics, cyber, all the things that we face as a state and as a country that will do great things together for the safety of our communities across the entire state. So with that, I will turn it over to the Nebraska Attorney General, Dr. Peter.
Thank you, Brian, and thank you for being here. Today, we're going to have a conference we've started this morning already, and it'll last to the end of tomorrow. We have approximately 200 law enforcement officials, local police departments, sheriff's offices from across the state. And the goal is to bring together these city and county law enforcement officials and let them know that we're going to be kicking off a program in which we partner with the federal authorities across the state of Nebraska to fight the #1 drug and #1 drug challenge for the state of Nebraska, and that's meth. We've been fighting meth for 20 years in Nebraska. And as you go across this state, it's very apparent when you talk to law enforcement officials, when you talk to county attorneys, that the biggest struggle they have in their communities is both meth addicts, meth users, those who steal to supply their addiction, and then those who deal in meth. And so the purpose of bringing this coalition together is that the federal authorities have incredible information, both nationally and internationally, about the trafficking of meth. And they've been terrific partners. I want to really call out the special agent in charge with the FBI, Gene Cowell. Gene has been a very supportive partner, and the federal authorities have done a great job of stepping forward with a strong effort to support this conference. And also Justin King from the DEA, very important partner. We actually started this partnership and discussion about 2 years ago and realized the need to move forward and be better coordinated by federal and state efforts to fight meth. Unfortunately, with COVID, it really stalled our efforts, and so we're very appreciative that we could put this together today. And if it weren't for those federal agencies and their financial support and their commitment to this issue, it would have been very difficult to put on that program. You'll see up here we have a couple of posters because this is not only a law enforcement effort, but it's also a public awareness effort. Much like in the opioid approach that we took 4 years ago and the coalition that we created there, it's a three-pronged approach of both prevention, treatment, and law enforcement. In opioid, the channel of distribution was much different, with a lot of prescription drugs that are involved. When it comes to meth, it's a much clearer picture of criminal activity and distribution, and that's why we're trying to coordinate a statewide effort. Now, as you know, there are several drug task forces in Nebraska where you have the combination of state and federal efforts, but there's so many communities across the state of Nebraska that don't have a task force to work with. And our goal now is to give those law enforcement officials in those different areas the ability to tap in to both the state resources and the federal resources to better prosecute, better investigate, and better prosecute. Also with the U.S. Attorney's Office and Jan Sharp, we've been working to talk about how best to prosecute. There will be certain cases that will meet the level of interest with the U.S. Department of Justice to prosecute. There will be other types of cases internally within the state, which the Nebraska Department of Justice will be there to provide support to counties and their prosecution of those cases. So this coordination is really important. We have to do this coordination in order to fight this battle. It's been really a stain on Nebraska communities for 20 years. It's getting worse. already just in this morning's program, we heard information from the DEA about how the amount of meth and the amount of meth being seized is drastically increasing in this state. And so if we're going to fight this, we have to be on the same page. The last thing I want to say is Nebraska is unique, and we hear this from different, particularly different federal agencies and officials who come into the state of Nebraska to work, whether it's FBI or DEA. And what they say is there's such a good spirit of cooperation among law enforcement agencies in Nebraska that you don't see in other states. And we have to take advantage of that. That spirit of cooperation to take on this battle is going to be key to allowing us to be successful. So with that, I'll turn it over to our U.S. Attorney General, Jan Sharp.
I know many of you don't know me. Again, my name is Jan Sharp. I'm the interim United States Attorney. Have been with U.S. Attorney's Office in various capacities since the late 1980s. I want to thank Doug Peterson. He hasn't given himself enough credit here for this conference that we're having. He's really been a strong force behind this, working with the FBI and the DEA to pull this off. As I said, I've been here since the late 80s, and meth is something that has been mentioned with various degrees of prominence during my entire career. When I first started off, the few meth cases we had tended to be biker cases, and we did our little stint where we went after some biker gangs, relatively easy to deal with. After that, in the 1990s, it morphed into drug labs, which again tended to be unsophisticated operations, which were, comparatively speaking, relatively easy to deal with. All of that has changed. You don't see the biker gangs involved in this. You don't see the local meth labs, but nonetheless, we are awash in meth, and it's something that we hear over and over and over across the state of Nebraska. Our #1 drug problem is meth. To give you a little uniquely federal niche that we deal with, we have major crimes jurisdiction on 3 of Nebraska's Indian reservations. Every single time that we have a meeting with tribal council members, we hear, we got a meth problem. And they're not big-time meth dealers like maybe you might see in Omaha, but it has a devastating effect on our communities. We get all kinds of domestic violence cases where meth is involved. We've had cases where there have been children born who have tested positive for meth right after birth. So it's a huge problem. We know it's a problem, and it's been a problem for many, many years. We have had an organized effort going on for 3 decades with our Organized Crime Drug Task Force and with our high intensity drug trafficking area task forces, where we have tried to deal with this problem. But the lifeblood of what we do has been our local task forces across the state. They work many, if not most, of the cases that actually come to us. And to give you an idea of the scale of the cases that they are bringing to us, we, in a normal year, and I'm not sure these last 2 years count as normal, but there might be 500 to 600 cases that my office would file, and we might charge 600 to 700 defendants. Of those cases, about 40 to 45% of those cases are going to be drug cases. And of those drug cases, 70 to 75% are going to be meth cases. That's how prevalent the problem is. And I want to combat some of the narrative that's out there that perhaps we're just scooping up drug users that ought to be receiving treatment, and maybe we're sending them to prison for too long. I will tell you that the cases that we're handling federally are not those simple drug possession of meth cases. The people we're prosecuting are distributors. Many of them have horrid criminal records. We are finding over and over and over again that there are firearms that are involved. That has been reflected in some of the serious sentences that we've received. We have, just within the last year, prosecuted some traffickers who received 20 to 30-year sentences. These are serious, serious cases. They have a huge impact on the community. We intend to be in this for the long haul. We've been doing drugs ever since I've been with the U.S. Attorney's Office. We're going to be in it for the long haul, and we're going to do it hopefully hand in hand with both federal and state law enforcement. And when I say hopefully, that's based on my 30-some years experience. We've had it from day one, and I expect to have that moving forward. With that, I'm going to turn it over to Jean Cowell with the FBI, and thank you.
Good morning. Good to see all of you here today. My name is Gene Cowell. I'm the special agent in charge of the FBI over in Nebraska and Iowa. And I stand here today shoulder to shoulder with the Attorney General, Doug Peterson, U.S. Attorney's Office, DEA, Nebraska State Patrol, to tell you about this new initiative we're launching to combat meth trafficking in the state of Nebraska. We have never done anything like this before in this state. What we're doing today and tomorrow, what this forum is launching, is we're sitting shoulder to shoulder with state and local partners, prosecutors, federal agents, police officers from across the state to talk about how we can work together even better to combat this problem of meth in Nebraska. I cannot emphasize strongly enough that the trafficking of meth and drugs is not a victimless crime. We all know meth is especially destructive in our communities and neighborhoods in Nebraska. And many of us are aware of the havoc it can wreak on our communities. Nebraska is one of the few states in the country where the number of overdose deaths from methamphetamine is higher than the number of overdose deaths from opiates. And the statistics are sobering. I think recent statistics, from 2018 to 2019, showed an almost 60% increase in the number of overdose deaths from methamphetamine in the state of Nebraska. And I also think it's important for us to note that the impact of methamphetamine goes beyond the individual drug user, but also impacts families, communities, neighborhoods. It was reported last year that over 1,000 children in Nebraska were removed from homes, were no longer taken care of by their parents or caretakers because of drug abuse. Now, I've spoken with recovering addicts, and many of them tell me that about the pain they feel of losing custody of their children, of not seeing their children for years, of having to resort to criminal activity, to prostitution, to obtain drugs they need to feed their habit. So our aim with this initiative really is to reduce the supply of meth coming into the state of Nebraska. And the way that we will do this is by working together with all of our partners, state, local, tribal, federal partners, working together to identify the most prolific traffickers in the state and bring criminal charges against them, state charges, federal charges, to hold them accountable, to bring them to justice, and then to identify the source of supply, to follow the source of drugs, to hold those people accountable. Like all of our partners, we will not stand idly by as we watch meth degrade our communities and our neighborhoods here in Nebraska. And I will also say our commitment goes well beyond this forum. This isn't just a 2-day session of conversation and training. It's a long-term commitment we have with our partners across the state to work together to surge resources wherever necessary to combat this issue. And we think that with this forum, with this initiative, we have an opportunity to have a profound impact on this meth issue in the state of Nebraska. Thank you.
Hello, I'm Investigator Tyler Cronkey with the Nebraska State Patrol. I also serve as a task force officer with the Drug Enforcement Administration. Colonel Bolduc wishes he could be here today. They needed to be in Lincoln this afternoon for a legislative hearing. I'd like to echo much of what has been said already by the leaders of our partner agencies, and I can also expand on this effort from the perspective of a task force officer. As a statewide law enforcement agency, the Nebraska State Patrol not only works throughout the entire state, but also has existing partnerships with local law enforcement agencies throughout Nebraska. Working within those partnerships and creating new partnerships is a major goal of this collaboration. The task force is already in place throughout Nebraska, providing structure of support to those local agencies, and our investigators regularly work with law enforcement agencies, and methamphetamine plays a prominent role in many of those investigations. Through this week's drug forum, many of our task force officers and leaders within these agencies are providing valuable information that local law enforcement can take back to their communities and put to use. We can supplement local investigations with our personnel and investigative tools. And furthermore, our task force officers can be the go-between for local agencies to have direct connection with DEA and FBI. More than anything, that's what we hope the local agencies take away from this conference, that there are resources and help available to deal with the issues methamphetamine brings to the communities across Nebraska. And I'll turn it over to DEA Special Agent in Charge, Justin Kearney.
Good afternoon. Start off by thanking the chief for hosting us and being such a gracious host and having us out here, and echo what my colleagues have said and recognize all the hard work that's been done by the people sitting here, but we have a lot of people that have put this together, and it's for the good of Nebraska. It's for the good of the people, and one thing I'd say is that the best thing we can do is continue to collaborate, and bringing people together, we'll share ideas and come up with better ways and hopefully move forward. Much like my colleagues have said, methamphetamine is the #1 drug threat in the state. It's fracturing communities. It breaks apart homes. Children don't have their parents. They are in state custody. And if our most valuable resource is our children, is our people, and anything that fractures that, and anybody who preys on that is an enemy of what we need to happen. No part of the state is immune to this. It's in the big cities, as people know, but it's in the rural communities. And it's not just a problem that is isolated to one area anymore. As you've already heard, we see it on native land, we see it in the small areas, we see it in the bigger cities. And with a highly addictive substance like methamphetamine is, what we see, and this is something we see throughout the country and really throughout the world, is the motivation of the drug trafficking organization is to keep people buying that product and to get more people buying that product. So that, really is a segue into the fact that, why is there so much coming in, and why is it being sold at a cheaper price than it was many years ago with a higher purity level? And just to give you some quick stats on that, the amount of methamphetamine seized in Nebraska has surged 293% in the last 5 years, with law enforcement agencies combining for approximately 268 pounds seized in 2021. If you put that into perspective, Memorial Stadium in Lincoln holds approximately 85,000 people. If you divide that 760 pounds seized last year, be able to put 65 dosage units of methamphetamine in each seat of the stadium. The seizures across the nation are up 77% from 2018 to 2019, and we don't really have as good accurate data from 2020 and this past year because of the COVID, so that's the data we're going with. We used to see the domestic labs. We saw the methamphetamine being produced domestically, and whenever we had legislative things that stopped that, we saw a high production of this methamphetamine produced primarily in Mexico. The Mexican methamphetamine is deadlier, easier to access, and accounts for roughly 69% cheaper than it was in 2005. So what does that mean for the people of Nebraska and the people of this country? It's a tragic impact. What it is a flooding of the market to keep people using it and to keep the prices cheaper. And we hear a lot today about fentanyl and opioids and what they're doing, but it's important that we don't lose sight of the fact that methamphetamine continues to be our #1 drug threat. All drugs are bad, no doubt. And people ask me sometimes, what's the worst drug? I say, well, it's the one somebody's addicted to. But whenever you have a high availability and a lower price, you're going to see more people gravitate toward things like methamphetamine. And we know it has a life-altering consequence for anybody that gets on it. I'd like to close by thanking my colleagues and partners who stand with us in the DEA and are working to find better solutions to these problems. And we also want to emphasize the education portion. We've talked about that, and how do we educate people to keep them from ever getting on drugs, specifically our children, which is our most valuable resource, as I've said. We need to teach them the dangers associated with methamphetamine, and also working diligently to stop the traffickers, and with the DEA, we're committed to put all of our resources to hold those accountable. We're not talking about the people who are using the street level amount, we're talking about the drug trafficking organizations who are bringing it in this country. Thank you.
If you guys want to come up and take questions. I'm not sure how you want to handle
They can unmute, and if they want to ask questions, maybe tell you who they are.
those who are on by conference call. If you want, you can also ask questions, but to those media here, I'll first ask anyone who's here in person if you have any questions for anyone who's spoken. Yes?
Mr. Peterson, a few years ago, you came out and talked about what a serious problem human trafficking was in Nebraska. And I kind of doubted what you said. But then look what we're at today. It's really become a horrible problem in Nebraska. How do you feel about methamphetamines?
You know, I think as everyone has said, you can't deny the statistics. And I think when we first started talking about human trafficking, it was difficult because some of the information as to Nebraska was limited, but we knew from intel that it was out there. And now it's become more apparent. But as to the meth, there's no denying the statistics. And I'll just give you an example. And when I thought we made some really good progress in our coalition on opioids, but when I went out and spoke with law enforcement and would go into a county attorney's office, I would say, what's your calendar look like? What's the impact on meth? And I can distinctly remember in North Platte when I was meeting with Rebecca Harding, and she said, well, look, here's my afternoon calendar. I, in district court, have 14 matters before the district judge, sentencing matters and things like that. She goes, 12 of these 14 have to do with meth, and maybe one a month on opioids. And that just tells you the impact. And when the law enforcement are going to these houses and seeing children being removed and seeing the effects of a meth addict, or you see in the human trafficking area, a 18-year-old girl who allows herself to be trafficked and paid by meth. I mean, it just covers the board in all kinds of tragedy. And so that's why we look at it in three ways. The prevention, and this is one of the things that we're doing with this campaign and these posters, is we're going to go throughout the communities, we're going to reach out and do different news conferences across the state in the next month, because we want communities to buy into the prevention message. Businesses, schools, the federal authorities have been doing some work and going into the schools. I know the DEA has been doing some prevention programs there. We're going to build out on that because we need our grade school kids, our junior high kids to know how destructive this drug is to their lives. So this will be a prevention program. It's a matter of life or meth. And we're going to try to get those posters out and create greater awareness. As far as the treatment area, I think one of the encouraging things for the state of Nebraska is the state of Nebraska has done an excellent job between its cities and counties of coming together in cooperation on the opioid settlement agreements. And that's going to put us in really good position to receive the money early, because unlike other states where you had cities and counties all jumping in and creating their own litigation, it's really created kind of a scattered mess in trying to resolve the settlements in those states. Nebraska, the League of Municipalities, and NACO, we all work together, and we have a 100% agreement. We've got the paperwork signed and in. And so the state, over the next several years, 18 years approximately, we're going to receive over $100 million that's going to primarily go to drug addiction abatement, particularly opioids, but this can also be a related treatment issue. So it'll put us in a better position to look at funding treatment. One of the biggest challenges with opioid addiction is when courts are in a position to sentence someone to inpatient treatment, they're there for 60 days. Well, 60 days, most people will tell you, is not enough to address a meth addiction. And typically what happens is that same defendant then comes back into the community, same neighborhood, and within days, they're back on meth. So we have to get much smarter and strategical about that. And then the final one, unlike in the opioid situation, where the channels of distribution were so many through doctors and prescriptions, this is all very clear, driven by drug cartel activity. And so that's why the law enforcement element is so important. But I just want to make sure that everyone understands that this is not a completely law enforcement focused, but I think Nebraska is in a great position because of the quality of cooperation we have in across the state in law enforcement, the state patrol, and the federal agencies, that I think we can really set a model of how states take on this fight. Yeah?
Will local law enforcement agencies receive any resources to help them fight their local problems with the drug?
Yeah, that's part of what we talked about. Like Gene and Justin, if you guys want to talk about what that looks like.
That's a great question, thank you. There's a lot of resources the federal government brings. A lot of the ways that we target crime problems like this are through the use of task forces. You've heard us all talk about task forces. You know, what is a task force? It's not a working group, it's not a committee. It's really an endeavor where local police officers, sheriff's deputies sit side by side with federal agents, with DEA agents, FBI agents, intelligence analysts, working side by side every day to combat these problems. When we run these task forces, we provide vehicles, overtime to task force officers, we provide money for evidence purchases, provide equipment. So there's a great deal of resources we bring to bear. The OCDF program, the Organized Crime Drug Enforcement Task Force program, which is a national program, also can surge resources to sort of the higher priority cases. When we identify cases that are tied in to regional targets that are of higher interest, we're able to bring even more resources to bear. And those go directly to local police departments to help purchase equipment, pay for overtime, and support investigations. Justin?
The only thing I would add to what Gene said is, you know, what this also allows us to do is to have more boots on the ground quicker, and we can take those cases and then we bring them to the U.S. Attorney's Office, and we can take that federal prosecution where maybe we would have had a drug trafficker or somebody that in the system had been repeatedly, hadn't had as much time at the state level or something. But so it gives us more options, and it allows us to build that collaboration. And it also, something that we talked about this morning, I know Gene mentioned it this morning, was, you know, the sharing and gathering of intelligence and sharing it. And really, you know, using that to help us look at those hot spots and target those areas. So one of the things we really we really want to do as we're building this thing and putting it together is to, you know, have ideas and bounce those things off of each other as we sit in this room. And part of this is, you know, for us to find ways that we can really come up with, because doing this job for almost 20 years, I can tell you that narcotics investigators are some of the most innovative people you'll ever find. And you get them together and you really will be amazed at the things they can do and how they can put that together, because these people every day are living it in these smaller communities and things, and sometimes they don't have those resources. So it's really our job to bring that to them.
Let me just add one other thing to that resource. One of the objectives of all of this was that we know within certain small communities, they don't have a tie. They may be 1,000 population and they don't have a tie into a drug task force, and their county sheriff's department may be a sheriff and 4 deputies. So it's a fairly limited capacity, and if they have a possession issue that comes up, they may deal with that internally, and they may have a part-time county attorney, and all of that stays somewhat isolated. Well, there's important information that can come from that particular arrest and conviction. And we want those people to know in some of the smallest communities that it does matter, because that type of intel is, where did that person who was convicted for possession, where did they get their drug? And frankly, you can't arrest your way out of this problem. For those who have issues of addiction to meth, we have to look at treatment. But meanwhile, we can be getting intel, and intel both through the Nebraska State Patrol to work with and map out, and also with the federal agencies, and broaden our reach so that every community knows that they have that type of support network. And from a prosecution standpoint, they may have a prosecutor who would prefer to have the assistance of the Nebraska Attorney General's office, and we'll provide that to them. Did you have a follow-up?
It's from there's no such thing as a stupid question department. And what is the lingo of meth? Like, if I were to go out and wanted to buy some meth, would I say, I take 1 unit of meth, please? What is the lingo of meth?
Why do you want to know? No. Justin, do you want to answer that? Or?
Yeah, I mean, at this time, you know, there's all kinds of slang words, and we have some things. I think it's, I'd always encourage people to go to DEA.gov, and on our education side of that, you can pull up, and we've got from all the drugs, drug identification, you know, predominantly what we see now is what's called ice. And years ago, rare, and it was the high purity. And that stuff was not being made by the Mexican drug trafficking organizations, or what you call the cartels. What happened was in the early 2000s, whenever we stopped all the clandestine production of methamphetamine in the United States, the super labs were born in Mexico. And so anybody's going to call it ice. They may have some other words for it. And you know, you're going to hear people say things, you know, like you used to hear an 8-ball. You may hear somebody, I was getting a dime bag or something, you know, you would hear those words. What's alarming is what we used to buy an ounce of meth for in an investigation is what we all of a sudden were buying a quarter pound of meth for. What we were buying, you know, a pound of meth for. And I put that in context. As a street agent years ago, I bought a quarter pound of methamphetamine for $5,000. You can buy a pound of methamphetamine for $3,000 to $5,000. So, you know, and in California you might buy it for $1,500. You know, so flood the market, make as much of it as you can. And so, and there's one other thing that's important is to remember that they're more than happy to sell it on credit. You know, and you know, if you ever been to the mall and had like a place that's out putting Chick-fil-A, they were like the first ones to put samples out. Somebody comes by and gets it, you know. They're more than happy to push that stuff out to get people on the hook so they'll pay it later. And that's part of their model. So I don't know if that really answered your question because it's really hard, it changes. But the other thing I would say, and this is, I don't want to hijack this, but social media has really changed the world. There's all kinds of emojis, there's things, you know, and we've pushed that out through, you know, we've been trying to educate schools and things to show that, you know, we've got things on that DEA.gov, and I know FBI has some stuff too, education programs so people can see that, but there's things that are going out, just there's emojis for different drugs now and things, and just the world we live in with social media.
I think one other really interesting statistic that we're seeing over the period of time is there may be a notion that this is a drug that's primarily used by late teens, 20s type. Actually, the group that seems to be growing the most is 30 to 39. So it really is a broad span as you look at the graph of where the growth is coming from. This is just not a young person's drug. There's a lot of middle-aged people who are using meth and destroying their lives. If there's another question, and then we'll go to you on the conference call.
You guys mentioned that you will be visiting schools and educating people about this. When exactly will this start?
Well, Gene makes a good point. This is not a kick-off and go home situation. So what we're going to be doing is we will be meeting on a regular basis, building out our education. At the Nebraska Attorney General's office, we've really developed a good relationship with the Nebraska School Administrators Association. And so we plan on utilizing that. We have been sending out letters to the people, business leaders in the community and those associations, asking for their partnership. So I think the DEA understood the model of getting people early with education in the schools, and now we want to build out on that. We don't have schedules on that yet, but it's going to be part of the three-pronged process. Are there any questions for people who appeared by the conference call?
Yes, I actually have a question.
Okay, if you can identify who you are and who you're with.
This is Carla Bonilla with Telemundo, Nebraska, and I would like to know what will the approach will be for the metro area. Due to the fact that it's a bigger area and there's a lot more drugs and more cases of it. What will be the future approach if we can have like a information on that?
With regards to the approach to the metro area?
Correct, with this new initiative.
Right. Good question. I think both Gene with the FBI and Justin with the DEA have been working, and Tyler with the Nebraska State Patrol is working in a task force out of Omaha. So those, frankly, those groups are pretty well developed. And so it's a good question because it does raise part of why we're doing what we're doing is, as I view the lay of the land, I thought we were looking very strong in Omaha and Lincoln, a lot of drug interdiction work there. You can see from the U.S. Attorney's Office, they're getting indictments all the time. I just saw one coming out last week with 500 grams. What I would say in summary is I think it's working very well in the metro area. Here's the concern, is what about the small community out in the panhandle, where you have just a small community where people are being devastated by the addiction because, as Justin said, maybe some of the drugs came in really cheap and people experimented with it, and now you have a significant addiction issue. So that's really kind of what we're trying to do, is take the lessons from the metro area, but also on a national standpoint, and better incorporate these communities across the state of Nebraska so that anyone across the state, whether their region is in a drug task force or not, that they understand that they have this network of support that the law enforcement do. And then also, what can we do in those communities, both from an education and treatment standpoint? I do think with regards to the treatment standpoint, a lot of that's going to be developed through what we already have on board with regards to moving forward in the opioid settlement cases. And those are going to be set up by regions across Nebraska and the behavioral regions that are already set up by Nebraska statute, behavioral health. But anyway, I think what I would say is, just briefly to your question, is that the metro area will be a learning pad really for a lot of what we can do in the rest of the state. Do you want to add to that at all?
I think you hit it pretty well.
Okay. Any other questions?
Yes, Ariana Martinez with Channel 8 News.
Mm-hmm.
I was wondering, in reference to penalties, is there anything where it's going to be stricter penalties for those who make and distribute meth in the state?
I'll pull Jan up here. One of the things that I know that's pretty common within the state of Nebraska is when you look at certain quantities and kind of the network of distribution. The U.S. Attorney's Office has always been a strong partner because of the degree of penalties. But I think, even in a smaller case, like I said, with regards to possession and penalties, I don't think anyone in law enforcement thinks that things are really improved upon when you have a possession case and try to hit them with hard penalties. They're dealing with an addiction issue. But when we're dealing with a distributor of meth, that's when we really do need the strong penalties. And if they're a big distributor, that's where we rely a lot on the U.S. Attorney's Office to do prosecutions on that, because the penalties are very strong.
Hi, this is Jan Sharp, the U.S. Attorney. And echoing what Doug said, there are federal penalties that, depending on the quantities involved, can invoke mandatory minimum sentences, sometimes 5 years, sometimes 10 years. The quantities vary across different drugs that are required to get you to mandatory minimums. We try to take no cases that are below a mandatory minimum, just because we don't want to usurp the role of state prosecutors. But in terms of the initiative that we're doing, that's taking off right now, that is not going to change any of the penalties because that's something that is set by Congress. We are working with the tools that we've been given. Frankly, those tools are sufficient in our view to address the conduct that is given to us. But the more serious drug traffickers that we're taking up to federal court, almost across the board, are going to be looking at mandatory minimum sentences. And if they have a prior conviction for a drug offense, that also can really up their sentence, sometimes as much as doubling what they're looking at in terms of a mandatory minimum. Is there anything else?
Hi, this is Aaron Bonderson with Nebraska Public Media News. I'm wondering, you mentioned the cartels there, an organization you're targeting to figure out sort of the chain of distribution and arrest some of the people who are sourcing the drug?
Yeah, the federal, both the FBI and the DEA closely study that, and they have for many years. And that's one of the things why this effort today is important, because it gives us better intel across the state of Nebraska, that both the Nebraska State Patrol can accumulate the data, the intel data, but also we can provide it to the DEA and the FBI, and that they can better coordinate and understand the patterns here. More data, better information, but I will tell you, just in today's presentation, we had 2 DEA agents give us a presentation on the cartels, and it's very eye-opening, it's very troubling, but the degree of information that they had, I think, was very important for us to understand what we're up against. And so that's why this partnership makes so much sense, and anything we can do on the local level to bring in more data and intel, we think will better strengthen our ability to fight the distribution networks in Nebraska. I was going to add, I just thought this was very interesting. On January 20th, the Department of Justice, the Nebraska office, Jan Sharp's office, came out with a few indictments. And just to get a sense, a 40-year-old person from Norfolk, Nebraska, with possession with intent to distribute 500 grams of meth on or about November 27th of 21. 500 grams, it's my understanding, within 1 gram of meth you can get 16 doses. There's also a 25-year-old person from Fremont was arrested with 50 grams with the intent to distribute. Another case of two 49-year-old men, 149, 141, who were arrested in Nebraska. They were from the San Francisco area, and they were caught with 500 grams of meth. Another case of an individual from Council Bluffs arrested in Nebraska with 50 grams with intent to distribute. Just to give you a sense, the convictions vary on these different years, but here's another one. Hastings, Nebraska. A 48-year-old man was arrested on conspiracy to distribute 500 grams. Now this is just in one indictment announcement within the last week, to give you a sense of how much of this drug is pouring in from both in-state distribution and these individuals coming from California. So it gives an idea of the magnitude of the problem and why this partnership between state and local law enforcement and federal agencies is so important.
Hi, this is Bill Kelly from Nebraska Public Media. Those are interesting anecdotes from the grand jury indictments. I'm wondering how many of those individuals are part of identifiable gangs or organizations, and that they're working within a structure, and what that tells us about the organization of the meth trafficking.
This is Jan Sharp again. Some are, some aren't. These distribution networks can be lengthy. We know that the drugs, in most cases, will trace back to Mexico. We know that from what defendants tell us that we've prosecuted, from informants that law enforcement works with. We know it from wiretaps that we have, that these drugs are going back to Mexico. But not all of these people, frankly, are in a cartel or gang members. But at some point, if it's come to us from Mexico, it's passed through some cartel hands at some point before it gets to us.
And one other follow-up question for both the U.S. Attorney and Attorney General Peterson. Again, a lot of the notes you've been making are anecdotal. I'm wondering if you have done or do have statistics available, especially at the county level, combined in the state, on the number of charges filed and prosecutions over the past few years. Whether you draw that information out of the justice system and compile it, and if so, if that would be available.
You know, Bill, we can work with the U.S. Attorney's Office. We don't have those numbers in front of us now, but why don't you give us a chance and then we'll get those distributed to the media so they have that sense. It's a good question.
Great, I appreciate that.
Any other questions? Okay, one more.
I know the focus is meth right now, obviously, but are we seeing a big decrease of overdose deaths and usage of other drugs in Nebraska?
I apologize to people on the conference calls because I should have been repeating the questions by media here in the meeting. The question is, are we seeing overdoses by other drugs? And one of the things, I'll speak to it briefly, and then any of the federal guys, if you want to touch base on it. I think what you're seeing on a national level is there's a lot of fentanyl. The numbers of fentanyl, we saw some figures this morning, are rising rapidly. Fentanyl is a synthetic drug to replace heroin, and the potency of the fentanyl that is coming up is extremely strong. There's some cases where the fentanyl has been laced in with meth, so it is a serious concern as to fentanyl, but I would say that spike has been fairly recent in the last 2 years, whereas the meth problem in Nebraska has been over 20 years long, and it's getting worse. And so that's why the focus is primary meth on this case. Do you guys have anything to say about fentanyl?
Yeah, I can speak to that a little bit. Justin King with DEA. One of the things that's important to note is that we recorded over 100,000 overdose deaths last year, with roughly just over 60,000 of those attributed to an opioid or a synthetic opioid, which the fentanyl we know. And we're seeing more and more of the fentanyl pressed into pill form, counterfeit pills coming across the southwest border at alarming numbers. And the concerning thing with that is the pills, people don't have as much of a stigma with a pill. They're more apt to maybe try a pill as injecting something or snorting something or smoking it. And we're seeing a trend where methamphetamine is being pressed into pill form as well. And so that is a concern, because most of the organizations that we work nowadays are polydrug organizations, which means they're going to be distributing multiple types of drugs. And we saw this when methamphetamine started to be pushed from the Mexican drug trafficking organizations, was they really started to piggyback the methamphetamine in with the cocaine loads and marijuana loads. And we would arrest a drug trafficker who said, "Hey, gave me this pound of meth," and said, "Get rid of it as well." So they were creating a market. So we're seeing the same thing happen with predominantly, first it was heroin, and then now it's fentanyl. Cheap to make, highly potent, make a lot of profit. And so we're seeing those lines blurred more and more every day. What I can tell you is it's very hard with a methamphetamine, and anybody who's worked methamphetamine traffickers for a long time, it's very hard, but what you do notice is quality of life, end of life happening a lot sooner with people that use methamphetamine. You see people die in their 40s instead of dying in their 70s. You see a lot of health problems and the strain, so it's really, it's a little bit more difficult because fentanyl, we do know it kills people a lot. You know, people overdose really fast, but you still lose a lot of people. And the violence associated with methamphetamine trafficking and methamphetamine use is really, really high. We see a tremendous amount of firearms, especially around methamphetamine and fentanyl distribution.
Okay, I'll take maybe one more question either from the conference call or here in the room, because I'm getting hungry.
Hi, this is Aaron Bonderson again. I'm wondering, why meth might be more of an issue in a state like Nebraska versus other states where, opioids seem to be the main concern. Does it have to do with population spread or something to that effect?
We keep calling Justin up here from DEA just because they're obviously the agency is focused on drugs. So I'm going to let Justin answer that if he can.
What we see, just like I was saying a while ago, when a drug starts to be more prevalent or prominent in an area, it will start in the more built-up metro areas. That's where your biggest distribution points will be, and then you'll see it start to gravitate out into your more rural areas. Well, methamphetamine has had a long time to build that distribution up, and it has embedded itself throughout the state. And, you know, it doesn't take a rocket scientist to understand somebody drives 2 hours to a bigger city, they go back to their area. They start making $10,000 a week on distribution, they're gonna keep doing that. Well, just imagine what the world looks like 5-10 years from now with the synthetic opioids. And so, you know, we're predominantly focused on methamphetamine, it's our biggest drug threat, but let there be no doubt that these other drugs, and it's not just that, it's other things that come in, those are also piggybacking on it, because ultimately it's continue to get as much product out here, and the cheapest product they can sell for the most profit, they're gonna do that.
Yeah, and I'd probably be speculating to try to say why Nebraska doesn't have a higher opioid problem than meth. But I think the history has just shown that this state has had an appetite for meth, and that's why our hope is that we can bend the curve on this significantly by partnering with local law enforcement, Nebraska State Patrol, and the federal authorities to do the best we can to help meth be far less common in the state of Nebraska. So with that, I thank you for taking time to be a part of this, and we'll keep you posted going forward. Thank you.
Thank you all.
Okay.
What hour?